By 2028, the country is expected to face a shortage of over 100,000 healthcare workers. A gap that will be felt mostly by those managing complex, long-term conditions. The biggest structural issues facing our US healthcare system today are the high cost of healthcare. It's really expensive and people are not feeling like they're getting the outcomes that they need. The system itself is very disjointed. We don't have outcome-based healthcare. And then one of the biggest challenges, I think, for almost everybody is access to timely healthcare. We're in a fee-for-service model, which is based on volume, so the more hours that are billed is basically considered better. It doesn't take into account what the patient really needs. So if the focus is on volume of services delivered, fee-for-service, then that is part of why we have escalating healthcare costs in this country. So Catalight, we are all about creating a more equitable world for people with developmental disabilities. And we do that because we believe that everyone has the right to timely, equitable care regardless of race, gender, sexual orientation, geography, or circumstance. Catalight's model was built on the premise that people needed to get into services within 10 days. That was our core guiding principle. We started with that premise and we knew that we needed to continue to grow and grow and grow and partner with our providers and help them grow their businesses.
Well, what really motivated Catalight to move to the value-based care model is it just made a lot of sense for us. We think it's the right thing to do. The way in which we've committed is we fundamentally believe two things. First of all, value-based care is the future. The second and more important reason to us is we believe that it benefits the families. For example, one of the things that has changed tremendously as opposed to traditional ABA models, we've built our care delivery systems to look at families holistically, to create the wraparound services and supports. Perfect example of why value-based care and really focusing on the holistic outcomes made a lot of sense to us and why we've been committed to the change.
At Catalight, we've developed a number of programs that are under the umbrella of parent-mediated treatment. That would be Ruby, Everyday ABA, Calibrate, and some other programs where we actually teach the caregiver, the parent, to work with their child. What we do is we teach them to use these different techniques that we teach in the different programs to use during their normal parenting, their routine parenting while they're getting their child ready for school or ready for bed or during the dinner time with the family. And so they're really able to teach their autistic child or their child with an intellectual disability directly and see the benefits of that.
So within our system versus a traditional system, we are able to talk about what that family and what that patient really needs to have better outcomes in their care. And so when we talk about that and we focus on well-being, increased well-being, we'll see stress levels come down, families' confidence go up in being able to care for their family member, and then we'll see outcomes actually improve.
You know, over time, as we've moved from a traditional system to a system that provides more options for families, we're really finding that we're getting a better fit. So we think by having a one-size-doesn't-fit-all philosophy that we're really improving the lives of the families.
When we think about one size doesn't fit all, this is where concepts like
Having different service modalities becomes really important. And as providers, this is one of the things that we are able to influence. So if we can introduce a number of different service lines and different modalities, have practitioners trained across different modalities like caregiver-mediated ABA or diagnostic services or group services or telehealth even. What we then do is create a scenario where our patients and their families can choose the path that they need to be on.
I remember a couple of years ago, we had a referral for a little guy, and the mother just had, 2 goals. One of the goals was to have her child be able to cooperate with a medical person, and the other one was for him to interact with his siblings. Those 2 things alone increased the quality of life for this little guy and his family. And that's, I think, what we mean when we talk about well-being being so important to the family and the patients that we serve.
So the healthcare industry needs to change in a number of ways in order for value-based care to become the norm. It is getting there. There is more movement towards it, and everybody needs to say that they believe that is the way forward, and that's going to be the best for their business, for their costs, and for their communities. If you drive up the quality of care and you deliver it in an individualized way, you are driving down the cost of care.
We have really transformed the way we deliver care. So we have choice and options for our families. And that means a lot to that system and that family. We really focus on what they need, and then we look at growth and expansion. And so we can do it for 20,000, 25,000, 50,000 families, but it still feels very individualized.
If we saw broader adoption in value-based care within care delivery, I think we'd see more meaningful outcomes for families. We'd see more efficiency around the care delivery, and we'd see a more holistic yet personalized approach to care delivery.
So what makes you the most hopeful about the future of care delivery at Catalight and the industry as a whole?
Wow, what makes me the most excited about what Catalight's doing and the industry as a whole? I think the change I'm seeing. Right? I've been talking about some of the barriers to that change, but there is a change in the way people are thinking about healthcare and the delivery of healthcare. And I feel also that the economics of healthcare is actually going to force that change. Catalight is in the forefront of that for the population that we are serving, and we want to keep pushing that envelope and really making sure that we are delivering exactly what people need, where they need it, and when they need it.
Value-based care really has the potential to transform our industry, but it will only do so if there is strong collaboration and partnership between providers and payers. As the CEO of Easter Seals Hawaii and Easter Seals Northern California, one of the things that I think about with Catalight as their main sort of value proposition, or one of their big strengths, is the ability to really articulate a vision around clinical innovation, around equity and access, and around outcomes that they then can help providers translate into reality. I feel extremely hopeful about what we're doing at Catalight to be able to expand and reach more clients, more patients, and more families. We're changing the industry. We're doing things differently. When I have interactions with our patients and families and I see meaningful change, I see growth, I see increased well-being, decreased stress levels within a family, that's what keeps me motivated.